She kind of didn't feel comfortable with the outcome, and it was trying to explain, we can always correct, add a little bit more here or there if needed. But we have to understand that to start with, this is the canvas that we're starting with, that we already have some asymmetry.
Welcome to the Beauty Talk podcast, where we feature how the best medical practitioners help their patients to look better, younger, and healthier. Now, enjoy the show, and here's your host.
Daniel Gao here. I'm the host of Beauty Talk. We feature the top medical practitioners in health and beauty, both inside and out. I have Dr. Diana Pena-Santiago, who is a board-certified family medicine physician and the founder of Prosper Health and Wellness, a primary care practice and med spa in Pembroke Pines, Florida. She's shaking up the beauty and wellness space by bringing medical expertise, aesthetic artistry, and personalized care under one roof. From Botox to biostimulants, she's known for delivering natural, transformative results that empower clients to feel confident from the inside out. A Latina, entrepreneur, wife, and mom of two, Dr. Pena-Santiago is proof that beauty, brains, and bold leadership can absolutely coexist. So, Dr. Santiago, welcome and glad to have you here.
Thank you for inviting me, Daniel. I'm glad to be here as well.
Yeah, so let's dive right into it. How did you end up getting into the aesthetic side of your practice?
Well, that's a very interesting question. I was open up a primary care practice, and here in Florida, everybody is wanting to look better, look younger. So I started taking classes just to kind of learn a little bit more about it, like dive my toes into it. And as soon as I took my first class, I fell in love with aesthetics. And the more I learned, the more I wanted to know, the more I wanted to practice, the more I wanted to do. And I think, seeing my patients, hearing their feedback, people think that aesthetic is something that may be shallow, superficial, or you only care about how you look. But no, it's more than that. It's confidence, it's restoring people's, there's other things in aesthetics that also works with functionality. So there's a lot into it, that is not only the looks.
Got it. Now, you have two parts to your practice. You have the primary care side and you have the medical spa side. So, what
Mhm.
would you say are some of the common treatments that your patients come to you for both sides of your practice?
I have a very young population. I have like most of my patients are in the age of 18 to 50, and a lot of them come for their annual checkups. They usually come like once a year to get their routine labs done, get their annual physical, and see how they're doing, how the health is doing. Like in the primary care side, that's like my most common thing. People would think like, oh, people don't go to the doctor to get checked up. And I do have patients that tell me like, oh, I haven't been to the doctor in 3, 5 years, but my patients are very good about getting their annual checkup. So that's like the most common thing I see on a daily basis. And then on the aesthetic side, most of my patients are coming in for Botox and now very popular also weight loss that I do like both primary care and aesthetics.
Got it.
Like it has a component of both.
Okay, got it. Now, talking about those treatments, like particularly on the medical spa side, is there anything really new or emerging treatments wise that you're particularly excited about?
Well, I think that something that I'm very excited about is that now everybody is going towards like a more natural look. No one wants to be overfilled. People want to look like they are looking good, but like no one can tell what they've had. And that's something that is very exciting to me because that's kind of what I go for, what I strive for. I like, people to look themselves, but better, more refreshed, more natural. And I think that more and more people are leaning towards those types of treatments that, anything can be done in that way. Like, a lip filler. You can have overfilled lips or you can have a very natural lip because with lips, as you age, you lose a lot of hyaluronic acid. So people, when they get their lip filler done, can have a very natural look. And then you can do other treatments that stimulate your collagen, such as microneedling, and then you combine it with peptides, or you do like also chemical peels and different treatments that they're just gonna stimulate your own body's collagen and elastin production to keep you look younger.
Got it. Now, you mentioned peptides. So for people that don't know what peptides are, could you explain what are peptides? What do they do?
So there are different peptides combinations. For example, very popular right now is like semaglutide, tirzepatide, which they are peptides. They are glucagon-like peptides that are used for weight loss, rejuvenation, and treat different conditions such as polycystic ovarian syndrome and other health conditions. And then there are other type of peptides like salmon DNA that is now very popular that is anti-aging and has it helps with different conditions, wrinkles, skin elasticity, brightening, even for hair loss.
Got it. And you talked a little bit more about on like people are looking for more of that natural look. What's the reason you think that kind of the trend is starting going more into that natural look? They don't want to do the overdone look anymore. Like, what do you think kind of led to that?
So I think that Hollywood kind of leads a lot of trends. And you can tell that like everybody is loving Lindsay Lohan's look and they're like, oh, what did she do? What, you know? And I think that you can tell now that Hollywood stars, they are dissolving their fillers. They're looking towards more treatments that are more towards stimulating their own collagen. People are dissolving, you know, before people were doing like this big butts, putting in biopolymeters, and people noticed that some people were having like side effects with those. And I guess people started dissolving those kinds of treatments, and Hollywood is leading the trend towards more natural treatments, and people are following with that too, following that trend.
Okay. So if Hollywood's kind of leading that trend, I guess I want to get your thoughts on social media, like Instagram in particular. I'm sure that you get patients coming in, they're like, I want to look just like this Instagram photo that obviously has been very heavily filtered and it's just not realistic. So what are your thoughts on like, has social media been a general good thing for the aesthetic industry, or do you think overall it's been kind of a bad thing for the industry?
I have mixed feelings about that. So social media, everybody puts out their best. Even people that, oh, I just woke up like this, really and truly, they didn't wake up like that. Yeah, like, oh, a day in my life, this is how I woke up. No, they didn't wake up like that with their hair done and everything. So, and people only portray on social media what they want to, like a curated, something curated of their life. It's not, you know, everybody's relationship is perfect on Instagram. Everybody's on vacation, and then if you lead with social media, you're gonna feel like, oh, my life is boring. I don't do anything. My partner is not as caring as these people on social media. I don't look as good. And then people, you know, look for their best angles. They use filter, they use makeup, and then, you know, that's not how they look on a daily day. But like even on social media, I've noticed that people are trying to use less filters.
Mm,
Like influencers, they're trying to use less filters because some people are conscious that sometimes they can be misleading.
mhm.
So even on social media, people are trying to, you know, use less filter, portray more of their day-to-day, like less curated lifestyle. But I think, you know, social media can be something good because you can educate through social media. You can be more knowledgeable. You can stay in touch with friends, family that otherwise you may fall out of touch of, but also can be misleading because you got to understand that social media is not real life, it's social media.
Yeah. Well, I'm sure that it's also frustrating when people come in with those photos. It's like, I want to look just like this. Can you make me look just like this as well?
Yeah, that's one thing you have to understand. You know, on social media, they'll show before and after, and they don't show the behind the scenes of that before and after. So that before and after might not be one treatment. That before and after might be a year worth of treatment. And might include different modalities. So you might see a before and after, and like same example that we started with Lindsay Lohan. Everybody's like speculating what did she get done, and you know, of course, she has not said what she has gotten done. So we can't tell, but probably involve a series of treatments. You know, facials, microneedling, even something people are speculating surgery. So when you see that before and after, you only see the result. You don't see the path to get to that result.
Mhm. Okay, got it. Now, Dr. Santiago, I want to talk a little bit more about your practice. Like,
Mhm.
what is really some of the differentiating factors when it comes to your practice? I know you have the primary care side with the med spa side, which is a little bit unique, but what are some other areas that really differentiates your practice from others?
So I think that the main differentiator of our practice is that we try to do personalized care. So we try to see the person as a whole. We try to treat everyone with respect and, customize our treatments based on the person's needs, on their background, where they're coming from, what they need. So that's, I think, one thing that is very unique. I have patients that come here and they said, "Oh, before coming here, I was going to a different place, and every time I went there, I saw a different doctor, or my doctor was never there." So I'm the main provider in the office, and then we try to tailor treatments to the patient specifically. When they come in for their primary care checkup, they always see me, and the goal is for us to grow and have more providers to be able to serve more people with that same focus in mind, being able to provide personalized care, deliver great environment, great results, both in the health side as well as in the aesthetic side.
Got it. Now, I want to talk about education because when it comes to what you talked a little bit about, you get some people coming in, they don't have realistic expectations. So how do you approach educating your patients on really the benefits of the treatments that you offer?
So I think that you got to start with trust. That's the most important thing. And I think that that's one of the things that makes our practice unique. Because when people trust you for their health, that's what's most important. Without health, you got nothing. So if they trust you for their health, they're also going to trust you for their aesthetics. So you gotta start with trust, being honest with the patient, being upfront. This is what we got, this is what we can do, this is the results that we can get with this treatment. And building that trust and relationship with the patient is going to be a key component so that they can be satisfied with their treatments.
Okay. And so when you have the trust, then from there, how do you determine really what is going to be the best fit for them? Because I'm sure you get some patients that come in, they're like, oh, I just want to look better, but it's not so defined. So at that point, kind of what do you do to figure out like what's going to make them look better in their eyes?
Yeah, so you got to start with the patient's expectation in mind, what they are looking for, and start from there. And, like deliver the treatment for them. Like I can make you look better, but I cannot do this. Like start with realistic expectations on what they can achieve with the treatments that you can provide and be able to say no. For example, if I cannot offer a treatment because I don't have it, be able to tell them, this is the best treatment for you. I don't have it available. I'll be happy to refer you to another provider that can treat you. So start with realistic expectations, and also when there's something that you cannot achieve, then be able to say, no, this is something that I cannot deliver to you. And you might lose clients because you're saying no, but you will gain trust.
Mm. That's a very important point that you bring up is that the ability to say no to somebody, if anything, like and as you mentioned, it actually builds more trust because you're saying no, because you really have their best interest at heart. It's not just about trying to maximize revenue per patient, but it's is this really going to be a good fit or not? And so,
Exactly.
okay. Now, I'm sure that you also get some people coming in with some very common misconceptions about the treatments that you provide. What are some of those common misconceptions you tend to hear a lot of?
One misconception that I have a lot is for some people that they think that there are like they're always like one treatment that is hard to sell for some people is like lip filler because they always think that they're gonna look like a dog. Oh, I don't want to look like a dog. But it's a treatment that I love, especially in elderly women, women in their 60s or 70s because they have a lot of lines around their lips. So, what providing some hydration, which is something that you lose with aging, that's gonna get you looking better, and that can be done delivering a natural result, not necessarily looking overdone.
Okay. So we have the lips part of it. Are there any other common misconceptions that you tend to hear a lot?
So another misconception I hear a lot is, very popular, like I mentioned, like weight loss is very popular right now. And people sometimes want to achieve a certain weight loss that is not achievable with medical treatments. So I have 300 pounds. I want to go down to 180. No, that's not going to happen. Like tirzepatide, which is the most effective medication with weight loss, the promise is 12 to 20% weight loss. So if you're at 300 pounds, 20% of that would be 60 pounds. So, you can lose more or less, but, you cannot expect that if you're 300, you're going to go down to 180.
Yeah. Okay. So now when it comes to the weight loss, I mean the GLP-1s, the semaglutides, the tirzepatides, those are, I would say, relatively new. I mean, I think it's only been about 2 years or so that they've really kind of been on the marketplace. What's your thoughts on the effectiveness of them? I mean, maybe not the effectiveness, but like, should people use them? Because there's some people that say, oh, it's great, it really helps them out. But then there's also that say, well, it also breaks down muscle. So if you're not working out along with it, then it could actually get you a net negative instead of balancing things out. So what's your thoughts on the weight loss drugs that are out there right now?
Yeah, so they're not as new as you think. They've been in the market for a very long time. They're just being like new in the market, marketed for weight loss and being like more readily available for weight loss. And I agree with you. I think that if you are going to go get medical weight loss, you have to go with a trained professional. Because if you just grab this medication and don't have the appropriate routine, the appropriate follow-up, you can have more harms than good. Yes, it is true that if you have a rapid weight loss in general, bariatric surgery, tirzepatide, semaglutide, or starving, you are going to lose muscle mass. So you have to this guided by an adequate provider that can educate you on you having an appropriate diet, that can educate you on, weight training, what you need to do to preserve your muscle mass. Because what happens is that if you go on weight loss and then you lose a lot of muscle mass, you're not meant to stay on this medication forever just for weight loss. They're approved for a year, 2 years, depending on the person's condition. And then if you stay on it and then you lose a lot of muscle mass, then you can regain a lot of weight, and then you're gonna have more fat than muscle, and your muscle is more metabolically active than the fat, so that can affect your bones. So definitely, if there's something that you're gonna do, you have to do it with a trained professional that can guide you through it. And then another thing is that you have to also take into consideration that obesity also carries a lot of risk with diabetes, heart conditions. So you always have to outweigh the benefits versus the risk. And it's not meant for everybody. I see people like, oh, I have to lose 5 pounds for a beach vacation. That's not the candidate for GLP-1. The candidate for GLP-1 is someone that is overweight, with a BMI of 28 or greater and other conditions, or a BMI of 30. So starting with selecting the right patient for the treatment, that's like the best place to start.
Got it. Okay. Now, Dr. Santiago, for my next question, I want to get your thoughts on how important artistry is. So, in your approach to patient care, and I think this is going to be very interesting to hear from you since you have the primary care side, which is very
Mhm.
scientific. You have this process step by step, like kind of follow the playbook. And then you have the aesthetic side, which a lot of people feel that there's a lot more artistry that's required for there. So, what's your thoughts on how important is artistry in your approach to patient care?
I think that artistry is important both for primary care and aesthetics, because artistry starts not only with, drawing, doing lips, it starts with saying hello to the patient, making them feel comfortable. You have to be able to make the patient comfortable so they can open up to you and they can tell them, oh, listen, doctor, I am depressed because I lost my dad, and this is affecting my sleep, and affecting my sleep is affecting other factors in your life. So artistry start with the art of being able to listen to the patient, being able to communicate, being able to educate. That's also artistry. And then of course aesthetics, everybody uh thinks of it as an art, but I think like medicine in general is an art. You have to have a little bit of an art inside you. where there is that you have like to cry, where there is like you have like to read, paint. There is some artistry related to that, even though it's a scientific science. Being with patients, even like radiologists, they have to have they're not dealing with patient necessarily on a day-to-day basis. They're more like looking at images. But if you think about looking at images, the heart has its shape, the lungs has its shape, so everything involves some sort of artistry.
Got it. Okay. Very well said. Now, Dr. Santiago, I'm sure that you've had some particularly tough cases that you've experienced throughout your career. Is there maybe one story that really stands out in your mind, or just a really tough case, and how you were able to work through that and get that patient a successful outcome in the end?
So I think that something that happened early on was we all are asymmetric. Like there is a saying like you have your brows are sisters, no twins. So you may have one lip that is taller than the other, one cheek that is more prominent than the other, one breast that is more prominent than the other. And there was a patient that I did a treatment on that she felt like one side was more prominent than the other, but that was her baseline to start with. You try to make people as symmetrical as possible, but in reality, we're not symmetrical. So she kind of didn't feel comfortable with the outcome, and it was trying to explain, we can always correct, add a little bit more here or there if needed. But we have to understand that to start with, this is the canvas that we're starting with, that we already have some asymmetry.
Okay. And do you have, I guess, a lot of patients that come in with body dysmorphia, where they kind of think of themselves way different from what objective reality is? Like, do you tend to get a lot of patients like that?
Luckily, I haven't had that issue.
Okay, that's good. Yeah, because I didn't know like a lot of aesthetic practices, they run to that
Mm.
issue. And I know sometimes it's not something that can be fixed by aesthetic treatment. It's more like
Mhm.
psychological at that point.
Yeah.
So, but I know that is something that does come up within aesthetics. And unfortunately, try and
Yes.
fix
So
that.
far, so far, I haven't encountered that problem, but I think that it's like you said, if you have that issue, you have to have a nice way to, predict to the person that they might need therapy. And sometimes it might be not necessarily like they have the body dysmorphia, but other things in your life are not going well. And then you want to fix the one thing that you think you can fix. Like, for example, I have some relationship problem, but I can fix my wrinkles. So you try to deal with that. Or I have this stress at my job, but I can treat myself to this other thing. So you're never gonna feel good if you don't. This is like something that is like 360. It's not only your body, it's your body, your mind, your soul, your environment, your family. So
Got
a
it.
lot that goes into it.
Yeah, and that's actually a very interesting viewpoint on it. Is that sometimes people don't get the treatments just for to look prettier or more beautiful. It's like they're trying need to compensate for something else, that's going on in their lives. So that's a very interesting perspective. I've never had anyone kind of bring it up from that point of view. So, but Dr. Santiago, I'm curious, where do you think the future of aesthetics is going? We kind of talked a little bit about people looking for more that natural look. There's some of these other treatments that are coming into play, but I mean, where do you really think the future of aesthetics is going?
So it is hard to tell because it's a science that is constantly evolving. And, I'm happy to be a provider at this time where so many treatments are available. You have so many options to being offered to the patient. I see that people that are able to afford it probably go more into more surgical routes like facelifts, whoever can afford it. I think that that might be something that people before would be like, oh, that's something that I would never get. I think that that's something that will be more predominant. But that does not say that you cannot get like non-surgical treatments because, for example, even people that have hair transplants, with the hair transplant, after hair transplant, they still recommend like PRP, microneedling, PRP injections. So I think that there will be more joint efforts between the medical aesthetics and the surgical aesthetics.
Interesting. Okay. Now, with your practice itself, what's your vision for proper health and wellness?
So my vision is to continue to serve patients, and I see us bringing in more providers to be able to offer more to service more patients, to be able to offer more treatments, offer different modalities of treatments. So I envision ourselves, I think that the greatest thing that any provider, any practice has is when their patients feel confident with their treatments and feel happy, and then they bring along their friends, their family. So that's why I envision us growing, because I already see we've only been in business for a year, and I already starting to see, oh, you're my sister's doctor, or my friend at work says that you're a good doctor. So word of mouth is really the best marketing out there. And I see ourselves growing just because of the quality of services that we're providing.
Awesome. Now, Dr. Santiago, what would you say is the most important piece of advice you can give to someone who's thinking about getting some type of aesthetic procedure or treatment done, but isn't sure which provider to choose?
I think that's a great question, because a lot of people, I think that one thing that I've seen right now is that there's a lot of offers, Groupons, and I think that before you get a treatment, make sure that you are choosing the right provider. So how do you know if this is the right provider? If it's too good to be true, then it might be too good to be true. So, if everybody is offering Botox $10, $12 a unit, and this person is offering it $6 a unit, then, there might be something behind it. That it might not be something that is FDA approved. It might not be something, it might be a product that's counterfeit. And you got to be very careful, because there is a reason why we follow certain protocols, why we buy from certain manufacturers, or we only get offer FDA approved. Because if something happens, which, with this, when you follow the proper channels, risk of complications are very minimal if you are properly trained. But if there were a complication, you have a lot number of the product that you purchase. But if you are doing a product with someone that is not getting products that are FDA approved, and you have a complication, you don't have anyone that you can complain to. And even if you can complain to, you didn't go to the right place to get the treatment. So they might not have, malpractice insurance. You don't have anyone to go to help you out.
Hmm.
So I think that now that treatments are getting more popular, more people are wanting to get it done. But I think that it's very important to choose the right provider, making sure that you're seeing someone that is trained, that has the the equipment that is certified, that is getting the products that are FDA approved. And also, an advice I also think is very good is look at those providers' results. Look at the provider itself, because everybody is going to have different approaches. My approach is that I like more natural results, but you may be someone that wants to look more done. So I might not be the right provider for you. So you want to look at that provider. How do they look? How they before and afters look? Does it vibe with me? That's also something important, to go to a provider that goes with the type of results that you're searching for.
Okay, very well said. Now, Dr. Santiago, I have one last question for you, but before I ask it, I want to point people to your websites at properhw.com and also propermedspa.com. So, last question is, what does beauty mean to you?
So that is a very difficult question to answer, because it means so many things. To me, beauty is more so about being at peace with myself. If I feel like I can sleep well at night, that I've done good for myself, for my family, for my community, then that is beauty to me. I think that beauty is more something inner, and what you have inside is what you reflect outside.
Hmm. Okay. Well, there you have it. Dr. Santiago sharing her expertise. So, Dr. Santiago, where can people contact you and your practice?
Well, we're located in Pembroke Pines, 1 Southwest, 129th Avenue, Suite 105, and our phone number is 754-888-9088, and we'll be glad to have you on.
Okay. Well, Dr. Santiago, it's a pleasure. Thanks for being on the show and sharing your message.
And thanks for having me, Daniel. It was nice speaking to you and meeting you.
Thanks for listening to the Beauty Talk podcast. Any questions, please contact the practice directly with the contact information provided during the show. We'll see you again next time. Bye for now.